Hi, everybody. Just letting folks roll into the room. This is the System of Care Advisory Council Learning Collaborative. We have guest speakers today from the University of Connecticut's Innovations Institute, which we are very excited to welcome them back into our space. And we'll just give folks a few minutes to get into the room, cameras on. If you're comfortable with that, we are recording this meeting and we'll be sharing it out so other folks who couldn't make it can watch it. So if you don't mind your image being on the internet, please do turn your camera on. It's always nicer to see the faces in the room. And Christy will be joining us as soon as she can, but she's picking up her little people from school. Adam's had a big day of system of care meetings. How was data committee?
It's good, yeah. The OHSU folks, I think, put together a pretty good list.
Laura, do you want to introduce yourselves, UConn team?
I'm happy to do intros for us, Anna, and take it away. Yeah. Do you think we're ready to go, or do you want to wait another minute?
Let's wait until 3:05.
Perfect.
All right, well, it's 3:05, so let's kick it off. And we're very happy to have your whole team here. So thanks for joining us, University of Connecticut.
Awesome. Thank you so much, Anna. Hello, everyone. Thanks again for letting us use the opportunity of you all convening as a system of care learning community to share some information, and today especially to engage you in quite a bit of conversation and efforts around moving some of the priorities that have been identified to deepen a more effective systems of care implementation, especially out of the work of the SOCAC and several local systems of care who participated in the SRSI assessment process. So I have been struggling with sound. So are others struggling to hear me?
Today you're good.
I'm okay on my end. Okay. Please continue to check me. Pamela, maybe you can check speakers on your end for a moment. Sometimes my audio does just disappear. So we are here a little bit as a team. So just a quick reminder, we joined you last month. We'll come again next month for a 3-part learning community. Today's focus is going to be on using data to make decisions and guide the direction of our system of care efforts. This is a learning opportunity we'd love for you to make your own. So please feel free to ask questions in the chat. We're going to do some polls and breakout rooms, so there'll be opportunity to join us in discussion and a couple of pauses for Q&A if you would rather wait for a formal invitation. Just a quick introduction of the folks that you've seen a lot. So I'm Johanna Bergen, she, her pronouns. I've been providing technical assistance to the local systems of care alongside Liz Manley, who joins us here. We'll both help in breakout rooms a little bit later. And then thank you for Denise Scholzbeck for joining us. Denise has been working with Kim alongside to support the SOCAC technical assistance. And we are honored to welcome our colleague, Tony, to join us today. Tony's going to take the lead on giving us some big picture thinking, and then we'll all be all hands on deck to do discussion. Tony, I'd love to pass to you. Make sure your screen sharing works up, and if you'll just say a bit about the work that you do at Innovations. And take it away.
Sure. Thanks, Johanna. Hi, everybody. Tony Bonadiohi. I'm a research assistant professor at Innovations Institute at University of Kentucky with my colleagues who are here and who have been working in Oregon. And I'm the data side of the house. So I handle evaluation pieces. So today I'm here to talk about how to use data effectively, to answer questions and track how well implementation is going and identify where there are, places that you may want to address or things that may need to be addressed. So I guess just some quick background. I mentioned I'm a research professor. I also am a clinician. So and today is my practice day. So I'm actually in my clinical office. And I just, want to say, I I want people to stop me if people have questions. I feel like it's sometimes data, as an evaluator, I feel that I often am not the people's most favorite speaker in terms of like it can get boring, or there may be questions, or there may be, it can be dry sometimes. So if there are things that come up, or like context or things that are of interest, please don't hesitate to ask questions. I also want to say, I try to I understand the complexities of data and how hard it can be to use and use effectively. As somebody who kind of wears that like nerdy data hat, but who also practices, I started in my internship at a large hospital system here. I'm in Baltimore, Maryland, at Kennedy Krieger, and they had just implemented this data feedback system where they were going to feed back data to all of us therapists, and we were supposed to use that data to improve our practice. And so we would set up these text messages, and the families and young people we worked with would respond to surveys sent via text message, and it would all get fed back to us and come to us in a spreadsheet, and we'd be able to look at it. There's a graph. And I remember sitting there thinking, this is awesome. And also, what do I do with it? I had no idea like how I was supposed to make any decisions in my practice based on like this great data that they were feeding back to us. And I just remember thinking, like, I always talk about how important this is, but I don't really know how to use it in practice. And so I just like to share that, I understand that piece, even though I'm going to talk about data. I understand that this can be hard, that it can be hard to know how to use data to make decisions. And I think it's a place where we're all learning and growing. And hopefully today, this conversation can kind of help with some of that. Sorry, was that? All right. So I'm going to share my screen here. And sorry, I feel like I should be much quicker at this. There we go. All right, can everybody see that? All right, thanks, Denise. You're on the top of my screen, so that made that very easy. Okay, so I'm going to talk about continuous quality improvement, what we may call I'll use CQI a lot, but it's really just kind of a process of using data to inform kind of questions or answering questions, and figuring out how implementation of services may be improved, and being able to track that over time in kind of a cyclical process. So that's the goal of this. Some learning objectives: understand the purpose of CQI. Just kind of, I'm going to give a very high level framework. I'm not going to get into a lot of details and vocabulary, but just really kind of the basic steps. And then discussing how we can actually implement those steps in practice, in terms of being decision makers and being kind of administrators and leaders. And then we'll do two kind of examples of using the SOC dashboard, how we can use that to answer some questions. This is something silly that my little story kind of gets to this. Like, we have all this data, but how do we so what is CQI? So there's a definition. I'm not going to read it to everybody, but I think the big idea is, and what I hope comes across in the presentation, is that it's really using teams. So a team, whoever that team may be, having a team that uses data to solve problems. It's basically the process. And so it's kind of boiled down to that. So what do you need? So I mentioned you need a team, you need a plan. And so that's kind of what we're going to talk about today, is kind of the plan of how we do this. And then you need data, right? And so there is, those can be challenging questions. Those are very simple things, but can be challenging. So when we think about a team, who's at the table, who can make decisions, at what levels, and how do things get moved up to the levels to where the decision needs to be made. And so kind of knowing what that structure looks like. I'm not as familiar with Oregon as some of my colleagues. Pieces that I've been learning about, and your barriers process. I think, is that the correct terminology? It sounds like there already kind of are these teams who look at feedback from providers or from people who are accessing services. So those teams it sounds like they're kind of in place already. And so there's a process for feeding things up. And so that is a general structure that we would use, and just making sure though that that team includes everybody who needs to be there that can support decision making. And sometimes, it's figuring out who that team is a very essential piece. And then a plan. Plans can be very complex, and we can use things like logic models, and we could have reporting templates and timelines, but they can also just be, we're going to meet, we're going to look at our spreadsheet that we use to track things, and we're going to, meet again in a quarter, next quarter or whatever it is. And then data, this is often can be the challenge for folks. Where is that data? How do you get access to it? Do you have the capacity to process it if you need to? Is there other groups who are processing it and can feed it back to you? How is it reported? How frequently is it reported? What are the specific pieces of data you need? Do you need a data use agreement and all those things? So that can be a complicated piece. The nice thing, I think, at least so far in my experience with Oregon, is the dashboard. There is an existing report template which routinely collects data. I know folks are going to talk about some other data sources as well that are available, but I think having that dashboard that's across systems particularly you're already like way ahead of the game in terms of having access to data. So that's a good thing, and can reduce the need to collect it yourself or get it from other people. Okay, so those are what you need, and then what do? You meet, you ask a question. So I feel like these all sound very simple, but we'll break them down more. So you ask a question, you'll look at the data you have to answer that question. Sometimes you have all the pieces of data you need to answer that question. Sometimes you don't. And I think that's can help you figure out maybe where more data is needed, and that might be a much more difficult process. But at least you can look at what you have, and then you can start the process of, figuring out what other things you need to answer a question. Once you ask that question, you look at the data, and you may see, that something needs to be addressed. And so then you make a plan. And when you make that plan, we'll get into this more, you want to specify specifically who's doing what, timeline, kind of like a SMART goals type process where you're kind of being very specific about what needs to happen, who needs to do what. And then I think one piece that's really important to that is also, how are we going to check to see if our plan is working? And that gets us to that next track progress. And then when you meet again, you're reviewing the data. You might ask a question, did our plan work? And you're checking the data, you're adjusting plans, and you repeat the cycle. So I'm going to actually, before I get into ask a question, I'm going to stop here. Does anybody I just kind of want to check the temperature in terms of, do people have questions? Does this seem kind of the level that's going to be helpful for folks? Kind of just talking through how we kind of run through this process.
Well, I would say yes, this is good, but that in between ask a question and look at the data, there has to be data analysis happening. And that's where we struggle because,
Okay.
we get data, but we don't really know exactly what it means or what it tells us we should do and like who's analyzing it. And, most of us are more like social service people, not like data analytics people. So I think that's a place where there's a gap for me.
Okay, great, thank you. Okay, because Lucy, I think for me, like data analysis, what I'm going to show is going to be very, like the example is going to be very basic in terms of like no real crunching numbers. You're looking at things. You're going to look at the numbers, but you're not necessarily going to have to do much with them other than look at them and some interpretation. I think that capacity to analyze data is challenging in lots of places. And maybe in the future we can talk about creating some of that infrastructure. We use spreadsheets and things so that you can enter data and it auto generates some reporting things. So maybe in the future we can come back because that's a whole thing in and of itself. All right. Anybody else? Or should we just keep going? I'll take that silence to move on. All right. Okay. All right. Thank you, Selby. Yeah. And so we'll do some of that. So I'll show you kind of the process that I use at least for kind of making sense of some numbers. And hopefully it's somewhat helpful. All right. So, step one was ask a question, right? So meet as a team, but then you want to ask a question. And so what are the different types of questions? So they could revolve around service array and workforce, or process. And when I mean process, talking about like how many youth are we serving? How long is it taking youth to get into services? How long are they staying in services? That type of, not just the outcomes, but what's it look like to get youth and families and young people into services. And then ultimately, everybody, I feel like a lot of people want to see outcomes, right? Like that's the thing we think about. But, the knowing those pieces beforehand, the process and things about the service array in your workforce really provide one, you don't have to wait a year to get those, right? Like those are things that you can look at more rapidly. And that's where you can identify issues that may ultimately lead to poor outcomes, right? So if you wait a full year to get outcomes, then, you may say, well, like what was going on? Well, families are waiting 6 months to get into services and then not ending up enrolling. And, that's really kind of not helpful for youth and families. And so being able to look at those process things that are happening more quickly allows you to kind of identify things that are going to ultimately impact your outcomes, but you can do it sooner and more regularly. So I kind of broke out each of these, some examples. Again, these are not all the questions. Your questions may be different. They may be tied to your, where you're at, but some general questions that we may ask around the service array or what are the services available to families, and how do those services kind of map on to the needs of the families or to the population? Do we have the services that the people in our region, our state, our county need? Trying to map that together. How much capacity do we have? Do we have, if we have long wait times, is it because we don't have enough capacity? Or, I've seen the other thing happen where, they're funding a lot of quote unquote beds, but they can't fill them because the needs of the population don't match the capacity, and so there's some alignment there that can happen. That's a is our staffing appropriate? So do we have enough staff? Are they being trained? Are they satisfied with their training? Are we seeing skill development? You can track, how well staff are improving in their skills. So that would be all those things around your service array and your workforce. And again, like this may be harder to track. Some of the stuff may be administrative around staffing. Are you filling all of your vacancies, staff vacancies? Like that stuff you may be able to track easier than things like the population needs. Like that may be much more challenging to assess and track. So process questions, kind of mentioned this earlier. How long is it taking to get families enrolled? If they're not enrolling, why not? I think is a question that we often, I make sure I include that often when I work with folks. It's like, why aren't families enrolled? Because that's gonna, when we talk about make a plan, that why is going to drive that plan, right? And so it's not just that they're not enrolling. We want to know why they're not enrolling. How many people being served? You can kind of see these types of questions. I think the last part down there around, are we delivering high quality services consistent with the practice model? So fidelity monitoring, a very important aspect. There are, again, data research shows that it's not being done very frequently in practice because it's hard and can be labor intensive at times and resource intensive. But I think if you can find a way to monitor the quality of your services, again, it's going to be, your research says it will be predictive of your outcomes in the long run. And so it's a way to track in a shorter time period to make sure that you're correcting as you go, rather than waiting to see that things aren't working out. And then finally, are families satisfied with services, which I think including youth and family voice into all of these pieces, I think it's a key element, because ultimately it's about those people that we're serving. And so trying to find out if they're satisfied, and that may be with services, it may be with staff, and maybe, with the workforce, they can contribute to the fidelity monitoring in some cases. Like there's lots of ways to include their feedback into how well their needs are being met. And then outcome questions, these vary depending on service. I do want to say, like, I stole this top one: at home, in school, and out of trouble. If any of you have ever worked with wraparound with Eric Brunt at the University of Washington, he always says those are his big three outcomes. Are young people at home, are they in school, and are they having trouble? And trying to sometimes keeping it at just those kind of main points. Okay, so what data do we need? We have just, again, very basic data elements. These should not, based on those questions that we just asked, these are the things we would need, right? Enrollment dates, referral dates, dates of service, all of those things are the elements that feed into answering those questions. And I know not all of these are available, and I, understand that. So this is best case scenario. This is if you're making a plan, these would be the things that, you may want to include in there, but you may not necessarily have them right away. And those kind of break down into these key pieces. So those data elements break into, fidelity, satisfaction, completion. So this is just a kind of summarization of those past few slides, right? So looking at capacity, fidelity implementation would be like the process piece, and then the outcomes. All right, so we have our data. So say we have our data. We're able to ask a question. We know our general questions. We have our data. So then what do we do? And so this is a little tracker that we've used in the past with some folks. And the goal of this is to take what we looked at to kind of bring everything down. It's one table on a in a Word doc. And what we do here is, we said we meet regularly. We look at the data and we ask a question. What do we want to improve or maintain? So what is our question? Then we make our plan. And so, we look at, remember I mentioned like that why. So we have to figure out the whys sometimes. And sometimes that comes from the data. And sometimes that comes from your knowledge of your system, right? And of your service. Like I don't know why. And I have to turn to the folks who do and say, like, you all know what's going on here. You have better ideas, better hypotheses about what's going on here. I can show you what the data say, but I can't tell you why that data says that. In fact, when I do the example later, that's going to be exactly how it is. Like, I'm going to make up a bunch of things, but I'm sure, folks from those counties know why things are happening, or why things may look the way they do. So that's the contributing factors. And then based on those whys, we come up with strategies. And we want to make our very specific plan, who's doing what and when. And I would say in here, and it's not written in here, but I would put how you're going to monitor it. What is the expected change that you plan to see based on the strategies and actions you're going to take? And very explicitly, we expect the time from referral to enrollment to decrease, hopefully to, a target. You can put a target in there if you have a target date. But you want to just be very specific about, like, this is what we're trying to do. This is how we're going to measure it. Because when you meet again, you're going to look at, did that happen? Like, what's the data saying? Did the data make the change that we were expecting it to make? If not, why not? Like, what didn't go well? What didn't go well? Did we not carry out our plan like we intended? You want to put all that context around it. And then what's our next step? Are we going to keep trying? Because sometimes a quarter isn't long, right? Goals can be ambitious. Sometimes it may take 6 months to a year to see that change, but at least you can track that it's trending in the right direction. Because if you put a plan into action and you don't see any change for 2 quarters, you may say, like, we need to try something different. This isn't working. And so that's what we want to be able to do. We want to know, like, okay, we need to shift our steps we're taking because this isn't working, and we don't want to wait any longer. So this is just our way to track. Okay, so here's my example. So we're meeting, so that's step 1 on our chart. Step 2, we need to come up with a question. And so I came up with this question. I just want to put that out there. This is completely like me kind of cheating. I'm not cheating. Because what we may do is, this is what your process may be too. Like, you may look at the data first, right? And then you look at the data. Like, I looked at the data because I needed to find something that I could talk about. But you may see something in the data and say, like, oh, like, that's weird, and you may ask a question based on what the data are, or it may be just a question you have. So, it could be, or somebody sometimes, in some of the states and organizations I've worked with, they said, so-and-so administrator came to me and asked, are we providing equitable services across race and ethnic groups? And so, like, there's your question, right? Like, so somebody else asked a question that you can go and try to find the data for. Or it could be something that you as a group feel like you need to know more about. So I came up with a question. Are young people with juvenile justice involvement accessing behavioral health services in my county? That's a very broad question. And so what I would recommend, and what I did here, is I kind of operationalize. I break it down into smaller segments. Part of this is based on the data I know I have. Like, these are the data I have. So these are the questions I know I can ask. So I took that broad question of, are they accessing behavioral health services, and said, okay, so how many youth, or what percentage of youth are receiving behavioral health services, and how does that compare to the rest of the state? How many, and this is, kind of dawned on me as I was doing this, because one way to look at it is as a proportion of youth receiving behavioral health services. But what also may be important is what proportion of youth with juvenile justice involvement, or who are, in the juvenile justice system, are accessing behavioral health services. Because those two numbers, depending on the size of the youth in you're serving behavioral health, may be very different, right? So you may, the percentage of youth with JJ involvement in behavioral health services, when you look at it from the behavioral health side, may be a very small percentage of your total behavioral health services. But if you look at it from the juvenile justice side, you may be serving a large percentage of those youth. It's just that that number is small compared to your overall sample of behavioral health services. So kind of looking at it from both sides. And then what type of services do young people receive with JJ involvement receive? And then comparing that to kind of the broader sample of youth, young people receiving behavioral health services, and then trends over time. I always like looking at trends over time. I just find it helpful to see kind of in which direction things are moving, because a lot of times we get feedback on what we're not doing well, and we can look at the data and see trends over time, and we can see things improving, but those improvements, we don't look at it over time, we don't notice them, right? If we're only looking at the here and now, the last quarter, we may not notice the trend we have of things actually improving over time. And from a strength-based, lens, I think that's important, because it also tells us, like, there's some things we may need to continue to do or do more of. That's also an important piece. All right, so we're going to start with the first question. So what percentage of young people have in behavioral health service have JJ involvement? Switching. Okay, so this is just screenshots from the dashboard. So I try to highlight some important parts. Selby, I'm sorry, I'm going to butcher your county's name. I feel like I should be better working with Multnomah. That close?
You can't see people, but they're nodding. Yes, you got it
Okay.
right. It's Multnomah.
Okay, good. I saw it and I panicked. I was like, I'm not going to say this right. But here, okay, so in the dashboard, I selected Multnomah here, and then I looked. We can see that 0.8%. So they served 7,300 youth, over 7,300 young people in behavioral health, and of that 7,300, 0.8% had juvenile justice involvement. So then I'm going to see how that compares to the rest of the state. I go back to this county. There's a select all button at the top. So I click that, it selects everything, and then I scroll down and I unclick Multnomah so that I take them out, right? And so now I'm comparing them to the state, everybody but them. And what we see is that they're actually serving, significantly less than what the state as a whole is serving. In terms, so youth with juvenile justice involvement, fewer in Multnomah are being served compared to the state. However, when I did this, I also noticed that their connection with child welfare and IDD is much higher than the state averages, or the state overall. So, just something, we will process all of this at the end. These are just things I noticed when I looked at the numbers. Willamette? No.
No. Willamette. I'm sorry. Well done on Multnomah, Tony. Well done.
Somebody asked about the scope of JJ 18 or under. So this was brought to my attention that they serve up to 23, but I don't believe the behavioral health data go up that high. I may be wrong, but the numbers changed in a way that seemed as if the youth served by behavioral health total didn't go up, but this percentage went down, basically saying that there's more juvenile justice. I included more juvenile justice youth, but they weren't receiving behavioral health services because they were over the age of 18. I don't know if that's true or not, but that's how I interpreted it. Or maybe they're less likely to be served with behavioral health if they're over 18, which is also an interesting question.
Yeah, I don't know about those intersections. In Oregon, juvenile justice can keep a person past their 18th birthday if they were convicted for a sentence, pre-18. And they're not, it would not be helpful to move them into the adult population. So if they're finishing out a sentence until they're like age 22, they will often keep them in the juvenile justice facility. So it's a little bit, that answer is a little bit slippery, Tony.
Okay. And that's why I stuck with 17. Because I felt for this presentation, I did not know. All right. So we looked at it from the behavioral health side. If we look at it from the JJ side, right? So now we're looking at if you see up here, we're in the juvenile justice analysis tab. So same thing, I selected Multnomah there. I selected everybody but Multnomah in the bottom picture. So we do see that they are serving a smaller percentage, so about 21% compared to about 26% of their JJ population or youth with JJ involvement are being served by behavioral health. But one thing I did notice too when I was clicking through here, and I didn't mention it here, but the number of youth in the juvenile justice population is a lot smaller in Multnomah compared to similar sized counties. So I don't know, again, I don't know your system well enough. This is where the context, I don't have the context to understand why that might be, where you all may very much understand why that's happening, but just things I noticed when I kind of click through the data. But here we see again, lower percentage than the overall state. But child welfare is higher than state. So, we'll talk a little bit about how I interpret that, and Selby, feel free to jump in if you have other interpretations. So then I looked at services. So again, I looked at it from both ways. So I looked at the 295 youth served by JJ, and then I looked at it kind of as the whole population. And so what's interesting to me here is, and so I didn't show you what I clicked to get this, but if you click secondary system involvement is what it says on if you go to the behavioral health analysis tab and you click the secondary system involvement, it creates these second little bars here. And these bars show you what youth in the secondary system, whatever you selected for the secondary system, what services they received compared to the overall population or the overall behavioral health, like everybody in behavioral health. So what we see here is that, only 62 of our 295 youth served by JJ had outpatient, and 10 young people had substance use outpatient, which normally you'd be like, okay, but that is a third of all youth in your behavioral health system who received substance use treatment also had JJ involved. Which, may be an issue of they are, some substance use prevention work. Like, is it often that youth or young people are getting in trouble legally first before they are getting access to substance use treatment? Or are they not being identified as substance users until they commit a commit a crime, and then like that's their entry point into substance use treatment. Or maybe that, any youth that's ever touched a substance and has JJ involvement, they automatically send them there. Like there could be very different answers to that question. And that's where the context and, your knowledge of your system comes in. Or maybe a question you don't know the answer to and need to look into further. But those are things that jumped out to me when I kind of look at these numbers, right? So when I look at what services they receive, I start to look at the comparison to the overall population, and it becomes, you see some outliers. All right, then trends over time.
Tony, it's probably interesting to talk about the context for our area, because with Measure 11, which is an Oregon measure, we decriminalized the use of most drugs. So we've seen a huge drop in substance use treatment, and especially for our youth, because they're just not getting pulled in the same way. It's an interesting question that you're still seeing heavy juvenile justice involvement, but that may well be the severity of things that they've done that have then accessed treatment, because we're just not seeing so many young people receive any kind of connection to that. So, I mean, interesting picture, and it's very influenced by our legal system.
Yeah, which is, and to me, like that is a very interesting policy question, as
Yeah.
well as interesting, how do we connect because that would just kind of spitballing here, but like it almost seems then that the criminalization process was the access to care, right? Your access point to care requires that somebody gets in trouble for using a substance, but we would want people to be able to access care without that. And so what does that outreach look like now that it's no longer tied to the criminal justice system?
Yeah, it's really interesting to look at.
So yeah, interesting, very interesting. So trends over time. So here I adjusted the date parameter, or the date box up at the top. So you can see these are 2021, 2022, 2023, kind of descending. And we actually see that juvenile justice involvement kind of going down over time. And so, again, don't know the reason for that. I can't even really speculate, but we do see that it is trending in that direction. And so that may be something, you talk with your partners in the county and your juvenile justice about, like, okay, why are we seeing this trend happening in this direction? And this is the same thing, but they're looking at the juvenile justice population who access behavioral health. So almost 30% in 2021, and then almost 20%, so a 10% decrease over a 3-year span. So here's just kind of a summary of all those slides. So we took all of that information, and it's really 3 bullet points. So we see that, compared to the rest of the state, Multnomah has less crossover between their behavioral health and their juvenile justice. Young people with JJ involvement are more likely to get substance use treatment compared to the general population of behavioral health. And the trend over time, we're seeing a decreasing trend over time. Now, I didn't go as far as figuring out and making a plan, because I don't know what the driving factors are for these. And again, like, you all may be like, yeah, this all makes sense because we understand the context of what's happening. But I hope this is helpful in, like, just ways to look at the data, again, kind of clicking on, asking a question, and then clicking to find the piece of information that you need. Did one more, because this came up several times. Did is what happens if if you're not the largest county in the state. Like if you only have a very small sample, how do you do this? So I just put some best practices. So like if you're gonna make comparisons, we're looking at percentages, right? Not whole numbers. Use larger but similar regions as a comparison. So when I say similar, I mean demographically, is it rural? Is it, frontier? I don't know if you have frontier designated regions in Oregon. But, looking for a region you can compare to or county you can compare to. Expand the date range, easy way to increase your sample. Looking at trends over time, because looking at all those time points and looking over larger periods of time is helpful. And then again, using county population as a comparison. So one of the things and this goes for big, larger counties too, or larger samples, is I pulled some census data. So US Bureau, if you just Google census data, like you can get the demographic for your county, like all that information is there. And so you can compare how well, if you have questions around equity, like compared to the population of our county, how well are they represented within our services? So I do a little bit of an example of that here. And then finally, be cautious with your interpretations, right? If you are serving 20 youth, it's hard to make big scoping statements about, any piece of data, but as long as you can look at trends, and I think if we're going through our action steps and you make a plan and you say, we're going to try to shorten times from referrals to enrollment, and you see that change, it's easy when you have that intention about it. It's easier to make the connection between, we did this and this happened, even if our sample is small. I should have be careful of outliers, but we'll talk about that another day. All right, so just a quick example here. Ask a question. Have we increased our reach with our behavioral health services? Have we been serving more? And so breaking it down into smaller questions. Have we been serving more young people over time? Are we serving young people from minority populations in our county? So 2 things about reach. Are we increasing the number of youth we're serving? And how are we reaching minority populations to identify as minorities? All right, so this is that over time. If forget what county this is. Don't remember off the top of my head now. But if we look at just 1 year, so this top one, this 28 is just 1 year. So only 28 youth are being served by behavioral health services, not a ton. But if we look over time, we see that we are actually increasing, right? Particularly in 2023, we start to see these climbs. We see really this kind of flat bar between 21 and 22. So to me, like that is an interesting graph. Something happened, right? Like what was happening in 2023? Maybe that was the pandemic. Maybe we're seeing like a flat line from the pandemic and coming out of the pandemic, or as things opened up. I'm just spitballing, but like being able to see what that trend is and then applying your knowledge to what was happening in the context. And then I did, Sherman, there we go, Sherman County. So there's the comparison of Sherman to, there's a small counties tab, but there's a lot of data in there. So there's a small county selection, but all those counties add up to a lot. But I selected them because in my mind, and again, this might not be right, if I'm comparing one small county, I want to compare them to all other small counties with maybe similar population densities and service arrays. So that's what I did. And you can see here, these trends are not the same, right? Like something happened in Sherman County in 2023. It wasn't a statewide, it didn't happen in all small counties. So like that to me says like, maybe it wasn't statewide policy. right? Like, is there something we were doing different in our county in that year that impacted that change? And then population, and then looking at kind of equity, you can pull this graph, this youth served by race, ethnicity, and these numbers may seem like, I live in Baltimore, Maryland, so like we're a pretty diverse city. So I was like, oh man, like that diversity, is there something going on there? But then I looked at the county and it's like, oh no, it actually maps on well to the overall county population. And so suggesting that, that reach is consistent with the population of the county. There's just kind of a summary. So I pulled all of these from the System of Care dashboard. I know there was the SOCAC report. I don't know if Christy, you want to jump on and talk more about that. And I am not familiar, well, I'm familiar with some of these, but not all of these data sets. If anybody wants to talk about any of the
I'll put
others.
a link to the data report. This was published, I think, in February by the data committee. So it's our first go at baseline data for outcomes for the system of care. So whereas the dashboard is really about service utilization, the data report gets to more of how we are doing towards those long-term outcomes we hope to achieve. So I think we'll talk a little bit more about the data report in June. Or I'll drop the link if you haven't seen it.
All right, I think that's, so we're going to do some breakout groups, but I have to jump off here at 4 p.m. your time. But I wanted to stop. If people have questions, I do have a few minutes.
Anybody have questions for Tony before he has to leave us? You're welcome to raise your little virtual hand or just unmute and start talking.
Joylene here. I'm going to speak up. Tony, I just wanted to thank you for your attention to accessibility and the way that you explained all of this to us. I just really, really appreciated it. So thank you.
You're welcome. Yeah, and I'm happy to try to use data, right? Especially because I know the dashboard folks have done a lot of work. So always good if we can put it to use.
Should I go ahead and open up those breakout rooms or?
Yep, I'm gonna pull up a slide, Anna, to show just verbally the options here in just a sec. So for those of you, for those of us on Tony's team, if questions come up as we continue to talk over the next half an hour, we know how to steward them back to you, Tony, as well. So yeah, feel free, if you're like me, the question comes as soon as the opportunity to ask it has left. As Tony said, we have this really rich resource of the data dashboard for you all. And for those of you that have worked with Liz and I, we oftentimes end up having discussions about what are we seeing and what aren't we seeing. So we would love to do a little application with you. So for the next 20 minutes or so, we would love to invite you to join a breakout room. Anna's going to open those for us in just a moment, and you get to opt in to the breakout room that you want to go to. So if you are intrigued about what Tony just showed you about looking for trends or finding something different about your population served compared to your census data, or thinking about, the youth that are served in multiple systems, we would invite you to join room 1 or 2. If you're interested in counties with smaller populations, we'd encourage you to go to room 1, larger populations, room 2. If that data dashboard is something you're already confident with, you're already using, and a different conversation would be better for you, the other 2 rooms are going to focus on TA questions you all have been asking us. So if you are like, hey, driven decision making is a great idea, but I don't even know what data means, We want you to go to room 3. We've got another example there. We can think about how to identify the questions that would then help you figure out what is the data that you might be looking for and where could you find it in your community. If you know you have a lot of data, Lucy, I was channeling you when I heard your question earlier, but you're like, whoa, data is one thing, analyzing it and using it or figuring out how to share it in a way that we are all talking the same language is the challenge we want to work on. We invite you to go to room 4. There will be a facilitator to get your conversation going, and then y'all can take it where you need to meet your needs. So y'all get to pick which room you want to go to. If you're a facilitator, could you please select the room that you were assigned to? And we will have 20 minutes for this discussion. So coming back 20 minutes after the hour.
So if you scroll down, you'll see the options and you just push the little blue button that says join next to the conversation topic that you wish to go have.
Let's get all back together.
I think we've all, those of us who are still here have all returned.
Okay, excellent. So yes, we definitely, I know that in our breakout room, we sort of like just got to the questions that we were really wrestling with. And so more time would always be good. For my facilitators in the room, is there any sort of high level or sort of time sensitive summary you would offer, particularly that might help us think about how we connect to our learning opportunity in June? I will go first. We have some advocacy questions emerging about what else is behind the data dashboard and where else might be there information available within the state that we could touch. So just started to get juicy around that conversation.
I have 2 things that I think are important. One was right to the end, and that is that the data is really important, but making sure that it doesn't take folks away from actually doing the actual work, right? So making sure that we support the data collection efforts in a way that is resourced right. And 2, the big question always about where do you start and what is the big question that you're trying to answer first, is a really important one that we continue to talk about.
Thanks, Liz.
So for me, Eva and I hung out. We looked at the dashboard, played around with it, and had some questions as to more information about what data goes into the data dashboard, and similar to what you were saying, Johanna, what else is out there? Eva, I don't know if you had anything else. I'm speaking for you.
No, and the other thing, Denise, is you looked at some really interesting sort of anomalies that are, I hope people get a chance to dig into.
Christy, anything from your group?
Yeah, I had room 4. And before I kind of give a quick recap, I am happy to be a data resource for any local system. So we have a research analyst that we are recruiting for. And in the meantime, like if you ever have a data need or data question, or you just want to like have a thought partner around like, oh, I really want to try and answer this question, where would I go? Like, please, my inbox is always open. Happy to be a support to you. Lucy, it was just Lucy and I. One great thing I think that was kind of fun is that Lucy was like, how does this data support our barrier resolution process? So we actually went to the dashboard and looked at some of the data that was related to a barrier that they're working on, related to SUDS treatment access for kiddos with co-occurring behavioral health and IDD diagnosis, and found some data that was new to Lucy and new to me, and spurred some really interesting action step ideas. Lucy, you want to say anything more about that?
Well, yeah, I just want to say that, Christy, you should put that link to the ODE data in the chat for everyone, because that's super interesting too. I just kind of clicked in there and like, whoa. So it's kind of neat that all this data is being collected already. It is challenging for us to figure out how to analyze it and what to you know, how to sort of use it to support what we do. But yeah, that would be great.
Yeah, happy to. So ODE publishes an annual report card on all schools and school districts. So there's one report card that's kind of like for gen ed, you know, kind of like graduation rates, how to, you know, do kids meet the learning benchmarks, but they also have special ed specific data reports for every school and every school district. So it's pretty interesting data, particularly given the challenges that people are experiencing in accessing special ed services in schools. So there it is.
Awesome. Thanks, Lucy. Thanks for Danny to add that in the chat. Dana, do you want to hop in with a question or something to add?
Yeah, I just wanted, I mean, Liz was in my group and she touched on it for sure, but I just always want to advocate for clinicians. There's always lots of things thrown at us for data from every program. I manage 4 Fidelity programs. There's lots of data that's needed, and I get it, and I love the data. And at the same time, there's all the stuff that is duplicated a lot of times, and we're always adding things to the people that serve people versus taking anything away. I feel like we never take anything away from them, and that takes away from serving the population, which is really the mission, honestly, in my opinion. And so I get that it's tough because we need the data, but we also need to get back to serving the people. So that's all I'll say.
Yeah, thanks for sharing that, Dana. And I'm remembering how Tony opened just with like, whoa, people said I collected all this stuff and threw it back at me, but then like, what would I do with it? And so I sort of add to what you shared, like if we collect information, then I would suggest we own responsibility for using the information that was shared. And if it's not being used, then let's, realign resources there. I have a lot of faith and excitement for all of you on today's session and all of the members that Liz and I have been engaging with in communities for being authentically interested in using the data that's available. It's just like, let's unlock that door, right? So we can we've got some little barriers. You're good at naming what they are. I think we can get them out of the way so you can move forward with using those. Christy beat me to answering the question in the chat. Thank you so much. We would love to share slides and see you share this information with others. We will be joining you all again in June. We're going to be continuing to talk about data with an eye towards what disparities are we seeing in the data and what do we do about it, right? So how do we turn that sort of knowledge into action? I've dropped some suggested take-home questions in the chat box. They're the things I heard you start being curious about today. And we would love to, we know that not all SOC members come to these learning communities. So if you have an opportunity on committee time over the next month, when you're talking to your exec committee, if you get some other input about these questions, consider bringing those to our June learning community. Christy, I totally threw you under the bus because I heard you say you wanted to meet with everybody about the dashboard. So there it is. We're honored to be a resource to you all. Welcome your questions via email if they didn't fit in this afternoon's session. And just a really big thank you for learning with us and being willing to talk about data because you care about improving outcomes for children, youth, and families in your community. That's what we've got for y'all.
Thanks, everybody.
Thank you.
Thank you so much.